Hello everyone, we are happy to present our current work on the associations between temperature at conception and metabolic outcomes in adulthood. This project can be placed within the research field of fetal programming, which explores how what happens in early life is connected to later life health. There's correlational evidence that shows that people conceived in colder periods of the year have lower BMIs. An effect mechanism might be brown fat, since brown fat can be activated by cold exposure. And in contrast to white fat, of which we usually think when we talk about fat, brown fat actually dissipates energy into heat, which is beneficial for metabolic health. Our project aims to provide causal evidence on this association, so we want to see if we can really trace back later life metabolic health outcomes to temperature at conception. A better understanding of these dynamics is very relevant against the background of global rising temperatures. So correlational evidence has just compared people born in winter and summer. Alternatively, one could compare health outcomes of people conceived in warmer or colder regions, as here in the UK, for instance, north versus south. However, season of birth is associated with long-run health outcomes itself, and also people decide where they live, so that health outcomes of children born in colder regions might just always be better and for other reasons than temperature at conception. So to get to causality here, we only compare people who were conceived in the same calendar month of the year and in the same region. For example, look at this region in the south of the UK. Of course, January will always be colder than July in that region, but in certain years, January is warmer or colder than usually. So for each region, we calculate the long-run mean temperature per calendar month. So in this region, let's assume the average temperature in January was 2 degrees. Then we compare that long-run mean to the actual temperature at conception of a specific person. So here a person was conceived in January 1952. Exposure is then defined as the deviation from the region month-specific long-run mean. So how many degrees warmer or colder it was in the month of conception of a specific person. In order for this to work, we obviously need a large data set. We exploit data on around 460,000 individuals aged between 40 and 69 years living in the UK. And we have data on various metabolic outcomes, including BMI, but also blood measures. Then we calculate backwards from the month and year of birth and determine the month of conception to assign month region-specific temperature deviations as described earlier. We looked at several metabolic outcomes and find that if the temperature at conception was 1 degree Celsius higher than the month region average, an individual's odds of being overweight, to have high levels of triglycerides and high cholesterol are increased. So we do find a causal association between temperature at conception and metabolic health outcomes in later adulthood. The effect sizes are rather small, but we also only have very rough measurements of temperature variation at conception, since we had to assume a 9-month pregnancy for all individuals, since we don't know at which gestational age UK Biobank participants were born. Also, temperature variation at conception is a very subtle prenatal exposure, so we actually find it fascinating that even such subtle variations in very early life can be linked to metabolic health outcomes in later adulthood. We believe that looking at such associations is highly relevant to better understand the long-run health implications of the climate crisis. Thank you for your attention. We are happy to hear your thoughts and comments, and we wish you an inspiring time at the NOVA annual conference.